When the VIP patient in room 318 started crashing and none of the doctors could figure out what was wrong, I knew I had to speak up, even though they treated me like I was invisible. As a nurse's aide with 10 years of experience at Metropolitan General, I'd learned to recognize things that fresh medical school graduates missed. You won't believe what happened next. I never expected that correctly diagnosing the rare metabolic disorder would lead to the patient's daughter Ruby investigating who really saved her father's life, or that my moment of courage would open doors I never thought possible. Sometimes, when you fight for what's right, the universe finds a way to reward your dedication in ways that change everything. Hi everyone. Welcome to Life's Changing Stories. Now, let's dive into today's story. The sterile corridors of Metropolitan General Hospital had become as familiar to James Rodriguez as his own apartment hallway over the past decade, with their harsh fluorescent lighting, perpetual smell of disinfectant mixed with stale coffee, and the constant background symphony of beeping monitors, hurried footsteps, and hushed conversations about life and death decisions that happened behind closed doors every hour of every day. At 32, James had been working as a nurse's aide for 10 years, his daily routine consisting of taking vital signs, assisting with patient care, emptying bedpans, and navigating the complex hierarchy of hospital politics that seemed designed to keep people like him invisible and voiceless, despite their extensive experience and intimate knowledge of patient care. James had originally planned to become a doctor himself, but financial circumstances and family obligations had forced him to enter the workforce immediately after high school, taking the nurse's aide position as a temporary stepping stone that had gradually become his permanent reality as years passed, and medical school seemed increasingly out of reach. His decade of experience had given him an intuitive understanding of patient care that often exceeded the textbook knowledge of newly graduated residents. But the hospital's rigid hierarchy ensured that his insights were rarely acknowledged or valued by the physicians who made the important decisions. The most frustrating aspect of James's work environment was dealing with the arrogant young doctors fresh out of residency programs, particularly Dr. Mitchell Harrison, whose condescending attitude and tendency to panic when faced with situations that didn't match his medical school training had made James's job significantly more difficult and stressful. Dr. Harrison rarely bothered to learn the names of nurses' aides, frequently dumped his mistakes on support staff, and had a habit of barking orders while treating experienced healthcare workers like they were incompetent obstacles to his brilliant medical practice. Despite the daily challenges and lack of recognition, James took pride in his work and had developed an almost supernatural ability to notice subtle changes in patients' conditions, slight alterations in breathing patterns, changes in skin tone, or behavioral modifications that often preceded medical emergencies by hours or even days. His observations had prevented numerous complications over the years, though the credit for these interventions invariably went to the attending physicians who documented the cases and received recognition for their supposed diagnostic skills. On this particular Thursday morning, James was completing his routine rounds when he noticed an unusual commotion near room 318, where several nurses had gathered outside the door, speaking in hushed tones and casting worried glances toward the patient inside, who had been admitted as a VIP the previous evening. James Rodriguez checked his watch as he approached room 318, noting that his shift was already running behind schedule due to an earlier emergency in the cardiac unit that had required additional support staff and delayed his normal routine of vital signs, medication distribution, and patient care coordination. At 32, James had developed an efficient system for managing his responsibilities across multiple hospital floors. But unexpected complications had a way of creating cascading delays that made every task more challenging and stressful. The gathering of nurses outside room 318 immediately caught James's attention, as experienced healthcare workers rarely congregated unless something serious was developing that required collective knowledge and collaborative problem-solving. James could hear the high-pitched beeping of multiple monitors spilling from under the closed door, suggesting that whatever was happening inside the room was escalating rapidly and requiring immediate medical intervention. "What's going on?" James asked quietly, approaching the group of nurses who were clearly concerned about the patient's deteriorating condition. "VIP patient admitted last night," explained Linda Martinez, a senior nurse whose 20 years of experience made her one of the most respected voices on the floor. "He's been getting worse all morning, and nobody can figure out what's wrong. They've run every test in the book, but he's still crashing." James peered through the small window in the door and could see Dr. Harrison pacing frantically around the patient's bed, holding the medical chart with visibly shaking hands while consulting with Dr. Patricia Coleman, whose phone call to request additional consultation suggested that the medical team was running out of options for treating whatever condition was causing the patient's decline. "Dr. Harrison is losing his mind in there," Linda continued, lowering her voice to avoid being overheard by the increasingly agitated physician. "He's called for every specialist in the hospital, but nothing is working." James knew better than to insert himself into a high-pressure medical situation uninvited, particularly when Dr. Harrison was involved and already stressed about his inability to diagnose and treat a VIP patient whose recovery would reflect directly on the hospital's reputation and the attending physician's competence. However, as James observed the patient through the window, he noticed several subtle details that triggered a memory from several years earlier when he had encountered a similar case involving unusual breathing patterns and distinctive skin pallor. The patient's breathing had a particular rhythm that James recognized, and the waxy quality of his skin tone reminded him of a case from 3 years earlier when an elderly patient had presented with similar symptoms that had initially stumped the medical team. James remembered suggesting at the time that the patient might be suffering from a rare metabolic disorder that was often misdiagnosed because its symptoms mimicked more common conditions, but his supervisor had dismissed his concerns and the patient had ultimately been treated for the wrong condition until a specialist finally made the correct diagnosis days later. James felt a familiar shiver of certainty as he studied the patient's condition, but he also remembered the humiliation he had experienced when his previous suggestion had been ridiculed and ignored, leading to delays in treatment that could have been avoided if the medical team had been willing to listen to input from experienced support staff. The prospect of facing Dr. Harrison's condescension and potential retaliation made James hesitate, but his conscience wouldn't allow him to remain silent when he might possess knowledge that could save the patient's life. Taking a deep breath and steeling himself for the inevitable confrontation, James knocked on the door and entered room 318, where Dr. Harrison immediately turned to face him with obvious irritation and hostility. "Who let you in here?" Dr. Harrison snapped, clearly frustrated by what he perceived as an unnecessary interruption during a critical medical emergency. "This is a VIP case, and I don't have time for whatever routine procedure brought you here." James forced himself to remain calm and professional despite Dr. Harrison's rudeness, knowing that his patient's life might depend on his ability to communicate effectively despite the hostile environment. "Dr. Harrison, I'm sorry to interrupt, but I think I've seen something like this before," James said carefully, choosing his words to convey both respect and urgency. "The patient's breathing pattern and skin presentation remind me of a rare metabolic disorder that we encountered a few years ago." Dr. Harrison scoffed audibly, his expression reflecting both disbelief and contempt for the idea that a nurse's aide could provide diagnostic insights that had escaped trained physicians. Are you seriously suggesting that you're going to diagnose a case that stumped multiple doctors? Dr. Harrison asked sarcastically. You're a nurse's aide, not a medical school graduate. Dr. Coleman, who had been observing the exchange while continuing her phone consultation, interrupted with a more practical approach that reflected her greater experience and confidence in her own medical knowledge. Let him talk, Dr. Coleman said firmly, ending her phone call and turning her attention to James. If you've seen something similar, tell us what you're thinking. James described the rare metabolic disorder he remembered, explaining the specific symptoms that matched the current patient's presentation and outlining the relatively simple treatment protocol that had successfully stabilized the previous patient after conventional approaches had failed to improve his condition. Doubt flickered across Dr. Harrison's face as he processed James's explanation, though he tried to maintain his dismissive attitude by claiming that such a rare condition was practically impossible given the patient's age and medical history. Dr. Coleman, however, was more receptive to James's suggestion, acknowledging that while the condition was uncommon, it was not impossible and worth investigating given their lack of success with conventional diagnostic approaches. Fine, Dr. Harrison said, with obvious reluctance, his pride clearly struggling with the possibility that a nurse's aide might succeed where he had failed. Do the test, but if you're wrong about this, there will be consequences. James immediately gathered the necessary supplies to conduct the diagnostic test, knowing that his job security and professional reputation were on the line if his instincts proved incorrect. The test results came back faster than expected, and James's eyes widened as he scanned the laboratory report that confirmed his suspicions with unmistakable clarity. Racing back to room 318, James burst through the door and thrust the test results at Dr. Harrison, his voice filled with vindication as he announced, "I was right. The rare metabolic disorder is clearly indicated in these results." Dr. Harrison's expression shifted from skepticism to shock as he reviewed the laboratory findings, while Dr. Coleman immediately took charge of the situation by ordering the nursing staff to begin the specialized treatment protocol that James had recommended. "I know this protocol," James said confidently, stepping forward to coordinate the treatment administration while Dr. Harrison stood awkwardly aside, displaced from his usual position of authority by someone he had previously dismissed as irrelevant to serious medical decision-making. The room became a flurry of coordinated activity as nurses followed James's instructions for implementing the specialized treatment, with Dr. Coleman supervising the process while Dr. Harrison hovered uncertainly in the background, clearly struggling to accept that his expertise had been superseded by a nurse's aide with no formal medical degree. Within an hour, the patient had received the appropriate treatment, and the medical team settled into the agonizing wait to see whether James's diagnosis and recommended intervention would succeed in stabilizing the VIP patient's condition. Late that night, as James's shift was ending, and he was preparing to leave the hospital after another exhausting day of providing patient care while navigating the complex politics of medical hierarchy, Dr. Coleman approached him with a softened expression that reflected both gratitude and professional respect. "The patient is stabilizing," Dr. Coleman said quietly, her voice carrying genuine appreciation for James's contribution. "The additional tests confirmed your diagnosis completely. You were right, Rodriguez, and your intervention probably saved his life." James felt a surge of vindication tempered by exhaustion, knowing that he had successfully advocated for proper patient care, despite the institutional barriers that typically prevented support staff from contributing to diagnostic decisions. In the days following the patient's recovery, however, James watched with growing disappointment as Dr. Harrison took complete credit for the successful diagnosis and treatment, basking in praise from hospital administrators and colleagues while conveniently omitting any mention of the nurse's aide whose knowledge and courage had actually saved the VIP patient's life. During a small ceremony organized to celebrate the patient's recovery, James stood in the back of the conference room while the hospital director praised Dr. Harrison's brilliant diagnostic skills and innovative treatment approach that had supposedly rescued the VIP from certain death. James's heart sank as he realized that once again, his contribution would remain unacknowledged and his expertise would continue to be invisible to the people who made decisions about hospital operations and personnel recognition. Just as Dr. Harrison was reaching the climax of his self-congratulatory speech, a young woman in her 30s stepped forward from the audience, holding several sheets of paper that appeared to be medical records and other official documentation. "I'm sorry, but that isn't true," Ruby Blackstone said clearly, her voice cutting through the murmur of approval and admiration that had been building around Dr. Harrison's presentation. Ruby identified herself as the daughter of the VIP patient and explained that certain discrepancies in the medical records had concerned her enough to conduct her own investigation into the actual sequence of events that had led to her father's recovery. "I spoke with several nurses who were present during the crisis," Ruby continued, consulting her notes while addressing the increasingly uncomfortable hospital administrators. Nurse Lisa confirmed that it was actually James Rodriguez, a nurse's aide, who first recognized the symptoms and suggested the correct diagnosis, but his concerns were initially dismissed by the attending physician. A ripple of shock went through the room as Ruby's revelation challenged the official narrative that had been constructed around Dr. Harrison's supposed medical brilliance, with the hospital director's face going pale as he realized the implications of having celebrated the wrong person for saving a VIP patient's life. Dr. Harrison sputtered denials and attempted to minimize James's contribution, but Ruby calmly presented documentation and witness statements that made it clear that the nurse's aide had not only provided the correct diagnosis, but had also coordinated the treatment protocol that ultimately saved her father's life. James Rodriguez recognized the rare metabolic disorder when multiple doctors couldn't figure out what was wrong, Ruby stated with unwavering conviction. "He stepped in when the medical team was failing, and he ultimately saved my father's life through his knowledge and courage." The VIP patient himself, who had been sitting quietly during the ceremony, turned to look directly at James and asked him to come forward so they could speak face-to-face about what had really happened during his medical crisis. "Is what my daughter says true?" the patient asked, his voice filled with genuine curiosity and growing gratitude. "Were you the one who recognized what was wrong with me?" "Yes, sir," James replied honestly, his heart pounding as he found himself suddenly at the center of attention after years of being invisible. "I recognized the symptoms from a similar case I'd seen before." A ripple of surprise swept through the room as the assembled hospital staff processed the revelation that a nurse's aide had provided the diagnostic insight that saved the VIP patient's life, while the supposedly brilliant Dr. Harrison had been unable to identify the rare condition despite his medical school training and residency experience. The VIP patient stood up and shook James's hand firmly, his voice thick with sincerity, as he said, "You saved my life, and I will never forget that debt." After the ceremony ended and the crowd began to disperse, the VIP patient approached James privately and gestured toward a waiting car outside the hospital entrance. "I think you and I need to have a private conversation," the patient said quietly, his tone suggesting that he had something significant to discuss. "I have a feeling that someone with your diagnostic skills and dedication to patient care would make an excellent doctor." James felt overwhelmed by the suggestion, as becoming a doctor had been his buried dream for over a decade, seemingly impossible due to financial constraints and the practical reality of needing to work full-time to support himself. "Sir, I'd be honored to discuss any opportunity you might have in mind," James replied, tears of hope and relief beginning to well up in his eyes, as he realized that his moment of courage might have opened a door he never thought possible. The VIP patient's offer transformed James's life with remarkable speed and thoroughness. Within months, all arrangements had been made for James to attend one of the country's top medical schools, with full financial support, including tuition, living expenses, and a comfortable apartment that allowed him to focus entirely on his studies without the financial stress that had previously made medical education impossible. James dedicated himself to his medical training with the intensity of someone who understood the value of the opportunity he had been given, and his natural talent for patient care flourished in an environment where his knowledge and insights were valued rather than dismissed. Years later, Dr. James Rodriguez walked the same hospital corridors where he had once been invisible, now respected by colleagues who valued both his medical expertise and his unique perspective as someone who had worked his way up from the bottom of the healthcare hierarchy. The arrogant young doctors who had once dismissed him were long gone, replaced by a new generation of physicians who understood that excellent patient care required collaboration and respect for the knowledge and experience of all healthcare workers, regardless of their formal credentials or position in the institutional hierarchy. James sometimes paused by room 318, remembering the VIP patient's grateful expression as his guiding star, and the moment when his courage to speak up had changed not only a patient's life, but his own destiny as well. His story became a powerful reminder that hidden heroes are everywhere in our healthcare system, and that a single act of courage can change lives in ways we may never fully understand until we have the wisdom to recognize that knowledge, compassion, and dedication matter more than titles or degrees when it comes to saving lives and serving others who need our help most. For more free stories and entertainment from our channel, please hit the like button and don't forget to subscribe with notifications.